rheumatoid arthritis is quite common. It's an inflammatory arthritis. It's one of the arthritis where the body attacks itself. Now, at your age of 19 years old, you might be considered to have juvenile rheumatoid arthritis, but it doesn't make any difference. You know, it happens in children, not as often as it does in adults, but it does happen to children. And not only is it crippling, but these kids, they stop growing. Their joints stop growing, and they have an early rate of dying. It's a very severe disease. It doesn't affect just the joints, it affects the entire body. Now, with the best treatments for rheumatoid arthritis, using all the immunosuppressant drugs, et cetera, about half the people who have this disease are either dead or severely disabled within 20 years of diagnosis. So we want to go for a better way than just drugs that suppress the inflammation and help relieve the pain. Not that these aren't important. You're right to want to go for the cure. And you have to ask, how do you find the cure for rheumatoid arthritis? Well, let's start by seeing where it's common and rare around the world. Rheumatoid arthritis was unknown, as were most autoimmune diseases, especially other kinds of arthritis. And when we're talking about rheumatoid, we're talking about lupus and psoriatic arthritis and nonspecific arthritis and ankylosing spondylitis. They all fit the same patterns. You look around the world, what you find is before 1980, these diseases were unknown in parts of the world where they ate still like I recommend, where dairy product consumption is rare. Well, people eat mostly starch, such as rural African and rural Asian countries. Of course, since 1980, populations around the world have emulated the Western diet. So rapidly is disappearing this immunity to various autoimmune diseases, including rheumatoid arthritis. And then what you want to do is you want to look at the scientific studies. There have been, multiple studies done. Studies published in some of our most important medical journals, including the Lancet and the British Medical Journal, where investigators have taken a bold step, and that is asked people to change their diet. A step that, by the way, that's not supported by the drug industry or the food industry. So you're not going to get research grants by doing this kind of work. And they've showed dramatic cures. For example, one study published in the Lancet where they put people in a fasting situation. It was a juice fast. And essentially in a week, everybody got better. And those who stuck to the diet, they continue to do well. And there are multiple studies. I've actually listed this on our website, drmcdougall.com. If you look at the hot topics sections under arthritis, you'll find an article I wrote called Diet, the Only Hope for Arthritis. And it lists the various studies that were done treating patients who have rheumatoid arthritis with diet. And you find that rheumatoid arthritis is very easy to treat, very responsive to dietary change. As a matter of fact, I've often said just jokingly, is that helping somebody with these inflammatory arthritis has a success rate similar to what you have with constipation when you change their diet. I mean, they almost always get better. And how long does it take? It takes about 4 to 7 days to start showing improvement. It takes that amount of time to clear the remnants of the food that are in your gut. It takes 4 to 7 days to get them out of the body. And the improvements continue up until I'd say about 4 months. At 4 months, pretty much everything you're going to accomplish, you've accomplished. You can't be unrealistic when you set out your goals to get better from one of these inflammatory arthritises. The good diet's not going to straighten your joints out. You've destroyed joints, they're destroyed forever. What you can expect is to stop attacks. Now, the basic McDougall diet takes care of almost everybody with these inflammatory arthritises, but there are some people who have to go a step further. Part of this process, the mechanism in developing inflammatory arthritis is the food proteins, animal food proteins. Not plant food proteins, but animal food proteins. They leak through the intestinal wall and they get into the bloodstream where the body makes antibodies to these animal proteins that end up attacking your body tissues, including your joints in this case. Well, to help the integrity of this bowel wall so you don't have such easily transported molecules from the gut into the bloodstream, is to improve the integrity of the bowel wall by getting rid of wheat, barley, and rye. These are gluten products, and some people who are very sensitive to gluten, it's a destructive disease called celiac disease. But for almost everybody, if you eat enough wheat, barley, and rye, you'll do some damage to your bowel wall, but you have to eat an awful lot of it. So the next step in helping somebody with inflammatory arthritis, autoimmune disease, is I I put them on a gluten-free diet. And the last step is an elimination diet, which is described in my May 2014 newsletter, which you'll find on my website, drmcdougall.com. The elimination diet are the foods that you're least likely to react to. They'd be sweet potatoes and brown rice and taro, with green and yellow vegetables thoroughly cooked and non-citrus fruits thoroughly cooked. You cook everything because it denatures the proteins, makes them less likely that you're going to react to them when you cook them. And this kind of a program is highly effective in people with autoimmune diseases, but that's the last step. Oh no, it's not the entire last step. The last step is for you to go on a water fast. And I have friends that do run water fasting programs. This is the ultimate in the elimination diet. You know, nothing but pure water. And on occasion, I have to go to that step to find out what's triggering the problems of somebody with an autoimmune disease. But we usually figure it out, taking the steps I talked to you about, which is the McDougall diet, the gluten-free diet, and finally the elimination diet. And think about it, cost-free, totally within your control, absolutely no side effects, and a general improvement in your health. Man, good grief, how could you lose? At least you ought to try this first. Your body deserves it before you go on to the doctors that are giving you medications that have horrendous costs and serious side effects, including death. Yeah, there's some steps you ought to take first. I'm Dr. John McDougall.